Good day everyone, I am Sheenah Llyle C Lagumbay from BSMLS and in this moment I am going to demonstrate the proper medical hand washing technique. First and foremost, let us define hand washing. Hand washing is the procedure done to remove as many organisms from the hands as possible. It is performed in a special way to avoid the spread of microorganisms. It is also considered as one of the most effective infection control measures in healthcare facilities. So the purposes of hand washing are: first, to reduce the number of microorganisms in the hands; second, to reduce the risk of transmission of microorganisms to clients; third, to reduce the risk of cross-contamination among the clients; and fourth, to reduce the transmission of infectious organisms to one's self. Additionally, its principles include: first, the use of running warm water in sink rather than in the basin; second, the rubbing of hands against each other for at least 30 seconds to facilitate the removal of microorganisms; and third, long nails and jewelry trap germs. So nails should be kept short and jewelries must be removed. And fourth, faucet is considered dirty. So use towel, single-use towel to turning off the water in the absence of foot pedals or sensors. Okay. There are many situations when to do hand washing. So it could be before and after eating, before donning gloves, or after removal of gloves. And in this instance, let's say for our case today, it is after touching body fluids or samples from an immunosuppressed HIV patient. So an immediate hand washing must be done. Okay. The first step of medical hand washing is to secure the necessary equipment. We have the soap or bar soap, the faucet or the running water, and single-use towel. Again, jewelries trap germs, so let us remove them if we have them. And roll sleeves up to the elbows if it is long enough. So for example, lab gowns like that, or sleeves, long sleeves. Okay, let us also check hands for breaks in the skin, like cuts. Okay, because if a health worker have that, he or she may be required to work with low risk for transmission of infectious organisms. So without further ado, let us start with the procedure. First, stand in front of sink without touching the inside and the outside portion. The inside area of the sink is a contaminated area, and reaching over the sink increases the risk of touching the edge, which is also contaminated. Okay. Next, turn on the water and adjust the flow and temperature to warm. Adjusting the flow prevents splashing, and warm water removes less of the protective oil of the skin than hot water. Third, wet the hands thoroughly by holding them under the running water. And apply soap. Hold the hands lower than the elbows so that the water will flow from your lower arms to the fingertips. And since we are using bar soap, let us apply them firmly in our hands. Water should flow from the least contaminated area to the most contaminated area, and our hands is considered the most contaminated than our lower arms. Fourth, make lather thoroughly. So this will ensure that all the surfaces of our hands and fingers are covered and cleansed. Next, thoroughly wash the hands starting palm to palm by firmly rubbing and circular movements. The circular action helps remove the microorganisms mechanically. Next, the right palm over the left dorsum with fingers interlaced. Like that. and vice versa. So this will remove the microorganisms from the back portion of our hand. Next, palm to palm with fingers interlaced. It cleanses the interdigital spaces. Then, the back portion of our fingers or the back of our fingers to the opposing palm with fingers interlocked. Then, rotational rubbing of left thumb with clasped right palm. And vice versa. Then, rotational rubbing of our clasped right fingers to our left palm and vice versa. Backwards and forwards. Nails and fingertips are commonly missed during hand washing. Lastly, rotational rubbing for left arm to the elbow. Friction removes microorganisms, and their circular movements and firm rubbing also helps loosen the dirt and the microorganisms. Wash the hands by keeping them lower than the elbows. Then, thoroughly dry the hands and arms from fingers to wrist. Moist skin becomes chapped easily, and chapping produces lesions. The usage of single-use towel also prevents the spread of microorganisms. Then use towel in turning off the water in case of hand-operated faucets like this. So this prevents from picking up microorganisms from the handle. Dispose it after. Lastly, inspect hands or surfaces of hands for obvious signs of soils and other contaminants, and also for cracked skin. And after that, we can do our aftercare.